begin with the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the April 12th, 2021 meeting for the Shawnee County Board of County Commissioners. My name is Kevin Cook. I currently serve as the chair this year, also representing District 2. Joining me today is Commissioner Bill Rippon, representing District 1. Good morning.
Good morning.
And Commissioner Aaron Mays, representing District 3. Good morning.
Morning.
Madam Clerk, our first item.
Our first item is item 3, consent agenda.
There are 3 items on the consent agenda. Are there any questions, or is there a motion?
I'll move to approve.
Second.
Motion to approve by Commissioner Mays, second by Commissioner Rippon. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item 4, new business. A, County Clerk, number 1, consider all voucher payments.
Commissioners, this morning we have vouchers totaling $2,635,116.36. A few highlights under this today. Under Bridge Project to King Construction for $76,780.26 is for the Northwest Glick Road over Ensign Creek Bridge. Under Sales Tax, HTK Architects for $37,056.25. It's for renovations to the Event Center. And then also under that is for the Event Center is McCown Gordon for $774,012. The project there at the Event Center is now 91.82% complete, so we're getting close. Under Infrastructure, Ham Incorporated for $290,150.79. That's for the Southeast 45th Street at Barrington Road project. And then also under Register of Deeds, Kansas State Treasurer, $30,000 is for the first quarter Heritage Trust fees. I don't have any questions about this, and I'd move for approval.
Motion made by Commissioner Mays,
Second.
second by Commissioner Rippon. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item A2, consider correction orders.
I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Rippon. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item B, Health Department, number 1, consider authorization and execution of contract C-142-2021 with the KDHE Bureau of Epidemiology and Public Health Informatics for $6,000 in funding to support the mosquito surveillance program in Shawnee County from May 16, 2021 through October 31st of 2021.
Good morning, Commissioners. Craig Barnes, Health Department. Don't know if I can say it any better than our clerk just said. So this is the approval that we're looking for our mosquito surveillance program. This is a partnership that we have with the Kansas Department of Health and Environment, as well as with the Kansas Biological Survey. We routinely, it's the 5th year of the program, we routinely set up 5 traps here in Shawnee County in areas where have been determined appropriate by the entomologist there with the Kansas Biological Survey. And so we will be looking to do that again, have some pay for staff time again out of this for setting the traps and then picking up the traps and then the shipping of those mosquito species then to the Kansas Biological Survey for enumeration and verification of the species. And so we look at this to identify any cases of West Nile virus that may be in our community, Zika, dengue, as well as other vector-borne diseases from mosquitoes. And then look at how we can appropriately, from the data that is received, look at mitigation efforts utilizing things like our Mosquito Dunks. And then this year we're excited with a little bit smaller increase or the increase in funding to restart our communications campaign that we have done in the past, which is our Shawnee County Dump Day, encouraging individuals to make sure they get out and dump standing water on Fridays during the day. So with that, I'd be happy to answer any questions you may have.
Craig, after 4 years, what are some of the things that we have seen as a result of this program? What are some of the benefits to Shawnee County? Has
Yeah.
it benefited Shawnee County?
Yeah, I think it most definitely has been. One of the things I think that's resonated really well when we had our communication campaign going around is the public acknowledgement just of the dump day and how many people had come and told the health department that they now made sure they go out on Friday and dump the water that was in their dog bowls or in their the kind of the catchments, if you will, underneath pots and things of that sort. And just had been able to cut down the mosquitoes in their general property. And so when we see that happening, just kind of at a slow roll there, and then you kind of have that kind of societal shift, you know, that's hopefully, and in some sense of the trapping that we've seen, cut down on the mosquitoes. We've also created good partnerships with other county departments, similar like we have with Parks and Rec. We've been able to provide them with some mitigation efforts with the Mosquito Dunks, which is those non-toxic kind of like little donuts. I should have brought one today, I apologize. But to provide those for like the golf courses and the parks so that you can put those out in areas where water may catch after rain. And it's safe for the environment, safe for pets, dogs, kids, anything of the sort. And we'll cut down on the mosquitoes there. And so you have kids and families that can really get out there and enjoy the parks or the golf courses and not have to worry about always slapping the back of their neck or their arms in trying to get rid of those mosquitoes. So.
The questions?
No?
Is there a motion?
I'll move for approval.
Second.
Motion for approval by Commissioner Rippon, second by Commissioner Mays. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next meeting.
Thank you.
Item C, election office number 1, consider approval of request to hire an election manager office administration and board workers position at an annual pay of $67,707.62, including benefits, with funding from the departmental budget.
Good morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. Asking permission to hire a position in the office. It's been vacant for a little while. You know, we had a number of people who retired last year, so we've been in the process of trying to find some replacements. We're asking your permission to go ahead and fill this position. We found somebody we think is very qualified, will do a good job. We're really trying to find high-quality people. As you know, these positions have become somewhat more stressful over the last few years, and so we're trying to find people that we really think have the skills and the ability to do the tasks that will be a part of that position. So if you have any questions, I'd be happy to try to answer those.
Any questions for Andrew?
Done.
No? I'll move to approve.
Second.
Motion to approve by Commissioner Mays, second by Commissioner Rippon. All in favor say aye. All opposed? Reflect that it passes 3-0. Thank you, Andrew.
Thanks.
Our next item.
Item 5, I didn't want to say them. Item 5, administrative communications. Those two words didn't work well.
This is an opportunity for any member of the public or department head to address the commission on any item. Good morning, Dr. Locke.
Good morning. How are you?
Good.
Good. So, Dr. Erin Locke, I'm the health officer, and just wanted to take a few minutes of your time to update you on our vaccine rollout. So, as you all know, vaccine rollout first began in December of 2020. It's now April, and it has been going very well. We moved as a state into phase 5 on March 29th, and so now eligibility is open to all adults. For one vaccine, the Pfizer, it's 16 and up, and for the other two, it's 18 and up. So eligibility for everyone. Our Shawnee County Vaccine Collaborative continues to meet routinely, continues to work together as we distribute our vaccine. That we are receiving through the health department about like 5,000 to 6,000 doses a week. It sort of varies sometimes. I wanted to provide just a little bit of data for you as of last Wednesday, April 7th. And this data does not include VA numbers, so just so that you're aware of what it does and does not include. So as of last week, we had 60,000 Shawnee County residents who had received at least their first dose. 72% of those are with Pfizer vaccine, and 27% with Moderna, 1% with J&J, the Johnson & Johnson. Our residents in Shawnee County have received a vaccine from over 400 different providers across the state. And some of our residents have gone quite a long ways to get that vaccine. But the majority of residents in Shawnee County have actually received them through our collaborative. the top 3 locations being Stormont Vale, St. Francis, and the Health Department. March, as you would expect with the increase in vaccine allocation, was our most productive month. Over 27,000 people received their first dose in the month of March. And that is 45% of our total so far. So that was quite a big month for us. When we break it down a little bit further, actually I'm going to show you the state map here.
And while you're doing that, pulling that up, when you say 60,000, again, you're counting not just shots that were administered in Shawnee County, but for the Shawnee County residents.
Shawnee County residents, yes,
Okay.
that's right. They've gone, many have gone outside of our county lines to receive their vaccine, but it still counts in these numbers.
Correct.
Yep. And so this is actually from the KDHE vaccine website, and it shows the rate per 1,000. And so if I can move here. So our current rate in Shawnee County is 352 individuals per 1,000 have been vaccinated. And when we compare to other similar counties, we're doing actually pretty good. Here's Wyandotte and Johnson, Sedgwick's down here, Douglas. So just to give you kind of an idea there. Now that's total population. So it even includes the children who cannot receive a vaccine right now because of eligibility. If we remove children from our population count and we look at just adults, our rate is closer to 439 per 1,000. Or another way to say it would be 44% of our adults have been vaccinated with at least 1 dose. When we divide that down by age, over the age of 65, 73% have received a vaccine dose. When we look under 65, in that 18 to 64 age range, 1/3 have received a vaccine dose. So we still have a little ways to go in that under 65 population. When we look at our total who have been vaccinated, women are being vaccinated at a slightly higher rate than men, and in fact 60% of our vaccines have gone to women. When we look at it by race, and I'll provide white individuals and black individuals. Of our white Shawnee County residents, approximately 29% have been vaccinated. Of our black Shawnee County residents, 17% have been vaccinated. So there remains a disparity there. When we look at ethnicity, for Hispanic versus non-Hispanic, we're actually doing better in this category, and we are vaccinating at twice the rate of the state for the Hispanic population, and our rate for the Hispanic population exceeds that of the non-Hispanic population here in Shawnee County. Some of our interesting adaptive partnerships that we have created to try to reach people who may have some barriers. We have partnered with Jayhawk Pharmacy and Doug's Pharmacy to reach our congregate settings. So they have been, I just want to give them a note of appreciation for working with us and actually going to congregate locations and providing vaccine. In particular, one thing that wasn't necessarily addressed at the beginning is that you can vaccinate a whole nursing home, but there's going to be turnover. There's going to be new employees, there's going to be new residents. And so we've been identifying those different congregate locations with turnover and attempting to keep their vaccination rate high in each building. And the pharmacies have been assisting us with that, as well as the health department, of course. For our homebound population, our first homebound vaccination was provided on March 8th, and that was with our partnership with Jayhawk Pharmacy. And Jayhawk Pharmacy has vaccinated 24 homebound individuals. We then shifted to a new partnership we developed with the EMS and the paramedics with the Topeka Fire Department. And they are now vaccinating our homebound. And their first homebound vaccination was on April 1st, and so far they have vaccinated 25 individuals. These numbers may seem a little lower when we're talking about 60,000 people, but the time and the resources that goes into meeting a person in their home and staying for their whole period of time with their vaccination, it's a little bit of a slower process. And so we're quite pleased that we've been able to reach nearly 50 people already. Some of our other partnerships, just to give a few names of appreciation: DaVita Dialysis, Washburn University, Genoa Pharmacy, and Vallejo Behavioral Health, the Topeka Rescue Mission, and the East Topeka Senior Center have all been sort of our adaptive partnerships that we've created to provide vaccine. In April, we have a few mobile clinics that I wanted to share, and in fact, well, I'll go ahead and talk about them now. Our first one is with Fellowship Highcrest. We are going to be at Fellowship Highcrest every Friday in April, and those are for scheduled appointments. You can go to the Fellowship Highcrest Church website to sign up for an appointment. We also are doing walk-in clinics. We just did our second Saturday walk-in clinic, so next week it will be on Sunday. And so we're happy to provide these weekend days walk-ins to try to make it easier for individuals to be vaccinated. And at Fellowship Highcrest, it's the Johnson & Johnson vaccine. We are also working with Open Arms Ministries, and that's every Tuesday in April, and those are scheduled appointments. And I'll actually provide one phone number here that you can call to schedule your appointment. That number is 720-300-0029. And this is Pfizer vaccine at Open Arms Ministries. We also have partnered with Citizen Potawatomi Nation, and will be vaccinating at their community building in Rossville on Wednesday, April 28th from 1 to 7 p.m. and Thursday, April 29th from 10 a.m. to 4 p.m. This will be walk-in with Johnson & Johnson. And while, of course, we would like to reach our Native population, it will be open to everyone. So they have graciously allowed the use of the community building, and we really appreciate that. Just going to move this here, but just very briefly to touch on the benefits of vaccination. I know that we all kind of have some assumptions about it, but just to remind everyone that all three of the vaccines are very, very effective against hospitalization and death from COVID-19. So in my view, I think that's the best benefit from being fully vaccinated. However, you also do not have to quarantine if you are fully vaccinated, don't have any symptoms, and are within 6 months of your most recent dose. So even if you are exposed to someone who is positive, you don't have to quarantine. So that's another quite good benefit, I think, for those of us who would like to go about our daily lives. In addition, we do not need to wear masks around other vaccinated people in private spaces, or when we are around low-risk people. So the science has shown us that your risk is quite low if you're vaccinated of spreading it to others, particularly when everyone's vaccinated. That remains in private spaces only. And we believe that the vaccines continue to protect from variants. And I know that there's quite a bit of concern with the new variants that have been showing up more and more in Kansas. But if you want to protect yourself from those variants, get vaccinated. And so now with scheduling, this is Vaccinefinder.org. It is a very, very easy website to use. This is from the CDC. It was not up and going at the very beginning of the rollout, but at some point in the last few weeks, it has been out there and available for us. And so it's simple. Vaccinefinder.org is the website. You can actually choose which vaccine you're interested in searching for, and you put in your zip code and search for it that way. I did this last night and put in the zip code for the courthouse, and you can see how many different vaccine providers are in the area. So from here, it will take you to those websites or phone numbers that you need to schedule your appointment. We also have this on our Shawnee County Health Department website just for quick access, and it will provide phone numbers or websites for you to go to schedule your appointment. If you are a homebound individual or you know of a homebound individual, you can email us at covidvaccine@snitco.us or snco.us. And we also continue to offer the 251-4949 number for questions directed to the health department regarding anything with vaccines or COVID or that's health department related. So that's all I have for you today. Any
Fine.
questions?
Thank you for the update. Any questions for Dr. Locke?
How many people are we seeing go through the Stormont Vale Event Center every day for vaccination?
I do not know the exact numbers, but my understanding is that they can put through several thousand in a day if the need is there and if they have all of their vaccinators going that day.
Is there much of a wait to get a vaccination at this point?
Yeah, thank you. That's actually a really good question. There previously was, but there is not anymore. Appointments are available now, and so if you're someone who has been waiting your turn, maybe hoping that or thinking that other people needed it before you, the wait is over. We would really like for you to schedule your appointment.
Any other questions? All right. Thank you, Doctor.
Thank you.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. I just wanted to kind of feed off a little bit of what Dr. Locke had to provide, is that we also are providing inmates with vaccines. We have had voluntary clinics at the facility. We're almost up to 100 inmates that have asked for the vaccine. We are going to continue to work very closely with the Shawnee County Health Department, providing the, I believe it's the Johnson & Johnson one time to those inmates that are coming in, that are staying, and so we're seeing a great response from our inmates, but also providing to those officers that are who didn't make it through the first couple rounds and it's like that. And we've seen an increase that way too. So we're starting to see an increase in both the officers and the inmates as well. The other thing I was just going to say is today we started our Basic Officer Academy. I know last week we had the recruitment efforts, but we have almost 15 to 20 officers that are going through the academy since the beginning of the year. You know, we have seen a great increase of officers being hired. We've almost hired 20 officers at a time, so slowly but surely we're doing very well. And I want to give kudos to Betty and Angela for helping us and working through this recruitment. It takes money to do these kind of things, and we've researched and done some stuff. But I just wanted to say that we're starting our academy with some new officers, and it's going well.
Great. Thank you, Brian.
Thank you.
Any other members of the public or department heads that wish to address the commission this morning? Commissioner Rippon?
Well, I helped out Friday and Saturday with tulips at twilight. It was we didn't have the best weather Friday night. We kind of got rain towards the end of the evening, but the next night was very nice, and we had good turnout, and I think people were really enjoying themselves. So it was a good event. So,
Good.
and it's still going on, so
Yes,
don't
it
miss
is.
it.
Very good. Commissioner Mays?
Nothing from me.
I don't have anything else this morning. Our next item,
Item 6, executive session.
there is not a need for an executive session today, so we are adjourned.